Hello, everyone, and welcome to the webinar session, Deep Dive on Big Catch-up Monitoring in Tanzania. This webinar is hosted in collaboration with UNICEF, the WHO, Gavi, and TechNet21. First of all, a few housekeeping items before we start this session. Please note that this webinar is being recorded and that we will share with you the links to the video as well as the presentation slides later on by email. This session will be presented in English and will be interpreted into French and Portuguese. In order to choose the language you wish to listen to, you can click on the interpretation icon at the bottom of your Zoom window and select the language of your choice. Feel free to introduce yourselves in the chat box and tell us your name, where you're from, and you can also use it if you need any technical support. If you have any question during the presentation, please use the Q&A box, which is also available at the bottom of your Zoom window. Feel free to ask your question at any time, and our panelists will answer it after the presentation. We hope you enjoy this session, and now I will give the floor to Nassar. Nassar, over to you.
Thank you, Geraldine, and let me take this opportunity to thank all of you for attending today's webinar series on Big Catch-up. As you may recall, we had the series of webinar coordinated by the Regional Working Group for Eastern and Southern Africa, and 2 countries have already presented, including Madagascar and Mozambique. And today we have dedicated this webinar for Tanzania. And we have colleagues from Tanzania who will be part of the panelists. So we have from the MOH side, we have Mdachi and Michael who will lead the presentation. But we also acknowledge the participations of WHO as part of the panelists. We have Dr. William Mwenge. We have UNICEF colleagues from country office, Bulula and Alex. We also have Gavi SCM who is supporting Tanzania, Jonah. So welcome to this webinar. So we are expecting to have a presentation from the team, which will highlight the overview of Tanzania Big Catch-up effort, including key successes, challenges, strategies, and lessons learned to reach 0 dose and under-vaccinated children during Big Catch-up implementation. We also expect the team to highlight key innovative approach taken in the country to reach the unvaccinated children. We will have time at the end, as Geraldine said, to discuss and respond to questions that you may have. So feel free to put your question in the Q&A tab so that we can review them and answer at the end of this webinar. But we'll also have time for people to ask questions. So we believe that the presenter will use the time allocated so that we have enough time for discussion. In the chat, you will see also there will be a link for the survey that we ask you who participated to respond to that survey so that we can get the feedback on how you felt about this so that we can improve in the future webinar. So we believe at the end of this session, we will have actionable insights on how we can continue supporting the ongoing Big Catch-up initiatives in Tanzania as well as in other countries. So before the presentation from our colleagues in Tanzania, we will have a short presentation from our UNICEF HQ colleagues who will present the overview of Big Catch-up at the global level to sort of set the stage for the country colleagues to come in and present their experiences. So without further ado, let me give the floor to Ibrahim Dadar, who will from UNICEF HQ, who will present overview of big catch-up monitoring from the global perspective. Over to you, Ibrahim.
Thank you so much, to the Regional Working Group, and thank you, Nasser, for moderating this. Colleagues, I'm Dr. Ibrahim Dadari, immunization specialist with UNICEF HQ based in New York. Good afternoon, good morning from this side. I also could share the IA 2030 Data Strengthening Use and Working Group with Carolina. So it's a pleasure to be part of this to support the efforts in terms of monitoring the big catch-up. Next slide, please. So when we look at, in terms of the trends, you could see basically globally, there's been some form of stagnation in terms of the numbers of zero dose and under-vaccinated. We had a peak around the pandemic in 2021, but that dropped to about 14.5 million this year. But still, we're off track in terms of reaching the IA 2030 goals of reducing the numbers of zero dose by 50% by 2030. Next slide, please. So when you look at Tanzania, you could see the same pattern, basically that of stagnation fluctuating, but you could also see the dip in terms of coverage around 2021, which was the year we had the peak in terms of the numbers of zero dose. But very well, the country has mostly recovered. But then there was a slight increase in terms of the numbers of zero dose between 2022 and 2023, based on the WUNIC estimates by 1,000. So we hope the efforts in terms of reducing the numbers of zero dose is sustained, so that we don't have reversals. Next slide, please. In 2021, 2022, when we were prioritizing the countries for the big catch-up developing the global guidance, we looked at the top 20 countries with the highest numbers of zero dose, and Tanzania happened to be one of them with 220,000 zero dose children. But you could see the country has made significant progress between 2021 and date. That has dropped to 46,000 zero dose children, which is great. And the country continues to ramp up its big catch-up efforts, which is one of the things we're going to learn today in terms of how they've been implementing and what are the lessons learned with respect to monitoring the big catch-up. Next slide, please. This is basically showing the Africa region. If you look at the light blue bar, 2030, that is the target for IA 2030. For those who are not aware, IA Immunization Agenda 2030 is the strategic document for immunization for this decade between 2021 and 2030. And the ultimate targets are to reduce the number of zero dose by 50% by 2030 using the 2019 baseline numbers. So by 2025, we're supposed to be halfway of 25%. So the dotted line that you see between 2019 and 2030, that is the pattern we expect to follow. But you could see the bars above that are showing we're off track. Even though in the African region, we're seeing some improvements between 2022 and 2023, but still the numbers are far above the targeted numbers for 2025 and 2030, calling for acceleration of efforts, which is one of the pillars of the big catch-up, actually. Next slide, please. Okay, now let's look at the guidance for monitoring the big catch-up. So as I mentioned, the IA 2030 Data Strengthening Use Working Group, we took on this task and developed of course, working with partners, colleagues, regional working groups to develop the guidance on monitoring the big catch-up. Basically, some of the topics covered include basically different modalities for catching up, how to determine eligibility for catch-up, recording doses, also trying to adjust monitoring forms, and also alternative methods, because we realize that monitoring the big catch-up, perhaps some of the systems in the countries have not been well adapted or have not been designed ab initio to capture some of these big one-time events, which we hope should be sustained, because the ultimate agenda and the ultimate objective of the big catch-up is to actually have sustainable catch-up policies in countries which are mainstreamed and continued, such that if we have any pandemic or epidemic in the future that disrupts the immunization program significantly, and we decide to do a catch-up, already the systems are in place to actually take on the responsibility. So that's that. We have the document uploaded in TechNet for now, in English, French, and Arabic, and Portuguese. And we are working on finalizing the actual publication to be featured on the WHO website. Next slide, please. So we look at multi-pronged approach to monitoring and evaluating the big catch-up. So first and foremost is basically looking at the readiness assessment. How ready are countries to roll out or implement and roll out, as well as monitor the big catch-up? So we have a checklist that looks at with some very, targeted indicators meant to assess the country readiness in terms of preparation, in terms of setting up systems, in terms of guidance for in-country guidance and tools to be able to successfully implement the big catch-up. Then we now have other options which are embedded within the document, including adapting the administrative health information systems, the home-based records, the registers, the tally sheets, where countries are using health management information systems, electronic or otherwise. So we also have some recommendations on that. And then it captures some targeted assessments and real-time monitoring for rapid course correction. For instance, how do countries adapt or use the rapid convenience assessments, the load quality assurance for the big catch-up, some other surveys like the BSD as well. And then ultimately some case studies we also have methodologies on case studies. Next slide, please. So we spent a lot of time to ensure robust plans came out of the countries, including forecasting, securing vaccine doses, shipments. Those are big tasks. And then now to be able to justify some of or most of the investment, we need to actually look at monitoring, evaluating, and also learning from the big catch-up. And that is why you could see this graph basically shows along the time series how we're going to collate and also analyze administrative data, how we're going to ensure supervision, and also how countries are recommended to look at, for instance, targeted surveys where necessary, post-campaign coverage surveys, also review meetings. So this is more to make sure we have periodic conduct of this. And also ultimate case studies in some situations. So some countries are in different levels of doing this. Some are considering or have started working on case studies. Some have reported something on administrative data. And it will be interesting. We're going to learn from Tanzania, who has actually gone far with the big catch-up, to see what are the lessons learned, what are the obstacles, and what are the ways forward with respect to ensuring a sustainable catch-up going forward. Next slide, please. So this is the BCU monitoring form, the first part of the form. So the form basically has about 4 sections. First, it looks at the readiness, basically with 6 indicators, including SOP adaptation, recording tools, capacity building, including health management information readiness as well. And then we have the results indicators, basically looking at the status of maybe periodic intensification of immunization, SIAs, special catch-up or child health days that are targeted to implement the big catch-up, as well as looking at the actual number of doses administered, because that is very important to monitoring this. Next slide, please. Then the second other sections basically look at the assessment. How do we conduct rapid assessment? So it talks about BSTs and other targeted RCAs and LQAS, as well as what are the learnings? How can we document some learnings and disseminate in terms of the big catch-up? What are the challenges we are observing? How are we tackling those challenges? What are the successes? Because it's very important to also share some of the success stories, despite the obstacles we have. And then these are documented, and also this will help in terms of ensuring countries are better prepared, strengthen systems going forward. Next slide, please. So we have basically a submission guideline, how do I say, timeline. Currently, we're working on the first set of submission, thanks to the countries and regional working groups who are working very hard on this. We expect to have about 6 submissions, quarterly submissions, the first for this quarter. So two in this year, Q3 and Q4, and then we have quarterly by 2025, first, second, third, and fourth quarters. And then we have varying tasks and roles and responsibilities for each of the stakeholders working, both UNICEF, WHO, and other partners are working closely to support countries to see that this is successfully done. And as always, data flow, of course, comes from the country, but will have to be reviewed by the regional working group before it's transmitted to the headquarters. We have a dashboard where we visualize this. Hopefully, once we have this data feeding in, countries will be able to have access to see where they are with respect to implementing the big catch-up. Next slide, please. So this is basically just showing briefly the different tools, rules, responsibilities, and timeframes, particularly for the first reporting. Basically, as you know, of course, data comes from the country. So that is where data will be prepared and submitted, reviews, quality checks, sign off by the relevant ministries or in-country coordinating mechanisms. It could be depending on whatever the country has planned. And then this goes to the regional working group, where there are also quality checks, reviews, follow-up analysis, as well as ensuring consistency before this is now transmitted to the global level. Why do we want this data to move this way? Because first, we have accountabilities in terms of resources that are provided to countries, particularly, for instance, for the vaccines being procured and also some technical assistance provided. So we have to also, we hope this will be able to justify going forward more resources to be sent to countries such that this will improve program performance and program delivery. But very importantly, also, we're going to have very good learnings, because when there are discussions with respect to, how do I say, routinizing catch-up, and also designing policies or presentations to the SAGE, some of this data will be very, very useful in terms of shaping how proposals are made, such that we actually reflect the realities of what countries are actually going on, or what is actually going on in the countries. So it's very important. We know you're tirelessly working on this. We're a bit late, but it's very important we ensure that this task is completed as soon as possible. Next slide, please. So in terms of case studies, we have also a short guidance on case studies also published on TechNet. So basically, if you go to TechNet, you'll be able to find all of the materials from the big catch-up overall guidance to the monitoring, BC monitoring guidance, the case studies, and other related surveys. Basically, this is intended to have specific deep dives into a section or component of the big catch-up implementation and monitoring. And then it adapts, it kind of proposes a mixed methods adaptation by country. But this is flexible, and basically we are available to discuss with the country how to go about this. And if there's any other need, you could reach out to the respective regional working group focal points, or you could reach out to WHO HQ or even UNICEF HQ on this. Next slide, please. So my last slide looks at the basically real-time monitoring. So looking at this and with the ultimate aspiration of routinizing catch-up, ensuring that catch-up is more systematic, it's more sustained. We're also working with University of Oslo, who of course hosts the DHIS2 module, to develop a specific module and the big BCU on catch-up monitoring, basically. Looking at the different parameters, including the indicators as well as the items mentioned in the monitoring guidance for catch-up, and also some of the learnings from the country. So the ultimate idea is once countries have this BCU monitoring module, they'll be able to plug and play into the DHIS2 to easily record and analyze catch-up monitoring data. Hopefully, we'll be having capacity buildings in the first quarter, and then we'll be planning to have some in-country pilot testing currently. So this is it from my side. Thank you, and looking forward to learning from you all. Thank you.
Thank you, Ibrahim, and thank you for the global overview, but also for the promising futures. You can see the last slide shows that we are moving well in terms of monitoring, and the work is on progress to make sure that we have a real-time monitoring, which is great and promising for this big catch-up initiative. So without saying too many things, let me invite Mdachi to present on behalf of the Tanzania team. And as I mentioned earlier, we have a couple of panelists who will be helping Mdachi in terms of responding to the questions and comments. So please feel free to put your questions in the questions and answers tab so that the team can respond at the end of the presentation. Over to you, Mdachi.
Hello, thank you. Thank you very much. My name is Dr. Joseph Mdachi. I would like to present on behalf of the Tanzania team, and I'll take you through the deep dive on the big catch-up. Please, you can proceed with the next slide. This is a slide is about just the outline of the presentation, the whole presentation, starting with the background rationale, and then we have key lesson, challenge, and solution to improve the monitoring of BCU. So this is just an outline of the whole presentation. You can proceed with another slide, please. I will start the background of the big catch-up. Tanzania is one of the countries that have maintained a high coverage in routine immunization, but trend of the routine immunization since 2019 have shown decline in the coverage. As a result, in year 2022, Tanzania was one of the countries with the biggest number of the zero doses accumulated over the years. And one of the reasons was that you have the COVID outbreak, and much of the resources were diverted in focusing into response to outbreak of the COVID. From that year, also we have seen increasing number of outbreak in year 2023 and in year 2023. So in response to that, we developed a recovery plan for year 2023 to 2025. And can you proceed with the next slide? So this is our immunization recovery plan for year 2023 and up to 2025. It has a main goal of strengthening immunization services to catch up, restore, and sustain the national immunization coverage as it was previous. And we have two objectives. The first one was to catch up with the 0 dose, and the second one was to restore the national immunization coverage. Next slide. So the recovery plan has 3 phases. It has a catch up, restore, and sustain. And we have in our recovery plan, in our plan, we have we set up target for each phases. For example, during the catch up, we were targeting to vaccinate at least 82% of the 0 dose in 81 most poor performing councils. And sustain, we were targeted to strengthen immunization coverage. So we set up targets for each phases to move forward. Please, next slide.
Dachi, can you please speak louder? Some people are not hearing you clearly.
Okay, let me speak close to the. Okay. So our plan also have immunization. We have a strategy that we used in our plan. One of the strategy was periodic intensification, strengthen reaching every child strategy, life course, immunization, outbreak response. These are one of the challenge of one of the strategic approaches that we are using in the recovery plan. So the plan, if you look on the immunization recovery plan on the catch-up, we have list of activity that we plan to implement in the catch-up. We have activities such as mapping to identify number of 0 deaths in the community and in health facility, revitalize outreach and mobile services, conduct periodic intensification. And on the recovery, we have integration of routine immunization with COVID vaccination. So these are some of the activities that we are in our plan. Next slide, please. Also, we did develop a national immunization policy, and we engage all our stakeholders. And in the policy, we define we have the life cause immunization schedules, and we are targeting children under 5 years. Can you proceed with the next slide? Also, the plan have a roadmap for accelerating the recovery, and it has a key steps that we were undertaking to ensure that the plan will meet its target. One of them is introduction of first dose of HPV mark switch is one of the key activity toward the roadmap, undertaking desk review to identify 0 dose. So this is just a snapshot to show the roadmap for acceleration of recovery plan implementation. Next slide. And this is this slide it shows the picture of the monitoring and evaluation framework that was used in our recovery plan. As I've mentioned previously, it has 3 phases. We have catch up, restore, and sustain. So initially we have indicator for each phases. Indicator for the catch up, for restore, and for sustain. We have baseline value, we have milestone, and data sources. So this is just an evaluation and monitoring framework. Next slide, please. We also develop a standard operating procedure, and in the standard operating procedure, we have immunization schedule for all the children, and we define the number of doses and schedule for each age cohort, starting from below 1 year to 12 months to 23 months, and 24 to 59 months. This the right side is it's shade for older children. Next slide. As elaborated in our standard operating procedure. Also, we develop tools for mapping of the under-vaccinated and zero-dose children. We have tools to be used in the health facility, and another one for the mapping in the community. So these tools were given before the initiation of the period to register the number, to register children who were either missing doses at the facility, or children who were not vaccinated at the community. So at the end of the day, we collect the two data, and we assign the target to the service area. From this two data tool, it was used to collect and ensure we have the information. And as you can see, it has we have a date of birth to help us in segregation of the birth cohort. Next slide, please. So this is a registration during the vaccination of the ketchup. It has the name of the child, date of birth, which is very important. Very important information that will help us at the end of the day to segregate the number of children by age cohort. For those who get the vaccine, and then we can segregate them. Next slide, please. This is one of the sample of the data segregated by antigen for the children above 1 year. And I've tried to paint the picture how this data was collected from different councils and aggregated. We can proceed with the next slide. Also, we did develop the AFIA campaign data collection system. This was developed by the Ministry of Health in collaboration with PATH, and we have support from Gavi technical assistance. And this tool help us to improve the data availability and immunization campaign, and also to collect data that we obtained from the field for the big ketchup. Initially, we were using the Google Sheets, and majority of the data that was collected was entered into VIMS. As a result, you will find that the performance of those before developing this tool, the performance of the councils was very high because of the number of ketchup of the children who were ketchup. Please, next slide. So what the progress have been made in monitoring the implementation of big ketchup? One, we have developed micro-planning and the mapping of area with high number of zero dose and under-vaccinated areas. We have updated the immunization data tool by data tool for routine immunization with the age segregation to capture the ketchup data. We have developed the AFIA campaign data system. We have implemented periodic intensification in the councils with the outbreak. We have integrated big ketchup into campaign. We have a campaign, we have a measles rubella campaign, and we integrated big ketchup in that campaign. We have conducted mentoring, supportive supervision, and we have intensified school-based HPV vaccination. Next slide, please. At the beginning of the year 2023, 2022, when we were starting the big ketchup, we have around 1,008,000 children who were identified as zero dose by using unique data. by the end of the June 2024, we have reached around 9,677 children, which is around 96% of the target we have initially during the lecture. Can you proceed with the next? This just show the pictorial presentation of the number of zero dose started from 2029, 2023, but it's the same as the one I have already presented. So we intensify big catch-up activity using periodic intensification, and we have reached around 96% of the zero dose that we are targeting initially during the initiation of big catch-up. Please, next slide. So Tanzania is transition to restoration phase. We can also see, when you look on the routine immunization trend from 2020 to 2023, you can see the changes in the performance of routine immunization, as seen by looking at the color. You see the number of cancer with the green, which is in 90 coverage and above, was increasing. Have increased in year 2023 about 90%, about 97% of the cancers, they have more than 90% of the of coverage above. They have coverage of more than 90%. Next slide, please. Also, okay, when we look on distribution of number of zero dose, you can see the number of green cancers, cancers with the green have also increased, and as you can see on the map from 2021, 2023, and 2023. You can proceed. This is appreciated. This slide also show how we are the number of children that we managed to reach during the integration of the measles rubella campaign with the big catch-up. You see, we have managed to reach around 13,000 children during the measles rubella campaign. So it show how the effort that was the product of integration of big catch-up with the measles rubella campaign. Next slide, please. On the vaccine stock, during the periodic intensification, the country utilized the routine vaccine stock, and we request additional vaccine from Gavi for phase 1 and phase 2. We really appreciate that we have phase of approval doses are still in process for delivery. So we really appreciate the whole support from WHO, UNICEF in ensuring that we are reaching we are achieving these goals. Next slide, please. So key lesson that we have learned through the monitoring of big catch-up. One is a political and technical commitment from the government at the national, regional, and district level and community level is one of the fundamental it energized the process, and one of the issues that has leading to the success we've seen. The second is availability of immunization policy for zero dose below 5 years. And third is excellent engagement and collaboration of partners. We have seen big catch-up implemented by number of implementing partners. And this number we are seeing is not only from the government, is also from the collaboration gained from the partners. The fourth is integration of big catch-up with the other activities such as measles campaign and nutrition intervention. And fourth lesson is use of available resources. For example, we used the viral routine vaccine stock to fast track the initiation of big catch-up. Also, use of locally accepted innovative approach to catch-up, such as setting cap in hard-to-reach areas, use of influential leaders, respected leaders, a social mobilizer was the key in reaching the target. Next slide, please. So what are the challenge? What challenge that we have faced during the monitoring of the BCU? One was delaying approval of additional doses. We've seen the process is a little bit bureaucratic. You have to acquire signature from the Ministry of Finance. If it can be improved to make it more simpler, maybe we can. I think is an area that we think we can address this challenge. The other area is monitoring of zero dose. Children need to be integrated into routine immunization as we are moving into restore phase, and the number of zero doses are still there. They are every day we are still getting the number. We are still getting the zero dose. So we have to integrate this into routine activity to make sure it's sustainable. And the third is ensure is the issue of financial commitment from subnational level or local commitment. It's still a challenge to get the local government to commit to ensure the big catch-up is sustainable is still a challenge. Also, we have during this time we have competing priorities such as polio campaign, measles campaign, and the HPV map. These were time-consuming activities, but they were worth it. Next slide, please. So what are the solutions to improve monitoring of the BCG? On the challenge of monitoring tool to track a BCG preparedness, we have lack of the monitoring tool to track BCG preparedness. Unfortunately, being early bird in implementing of the big catch-up, we didn't have the tools to monitor preparedness. So, and also we were struggling initially using different modes to collect data from field such as Google Sheets. So designing and dispute data management tools for pre, intra, and post BCU, big catch-up monitoring is very vital. Updating the data tool such for routine immunization such as BIMS, TIMRI, I think that is a solution that we should go there. On the issue of the coordination of partner and resource timeliness and implementation, continue integration with the peer is one of the areas that we think should be featured in the upcoming big catch-up. On the data management tools, integration of BCG into data. Also, another challenge that we are seeing is the dropout from MR1 to MR2. So, and one of the reasons that we have seen all is they are not daily delivered. So this is one of the reasons is fear of the wastage. So we are proposing to change it from 10 doses of measles rubella vaccine to 5 doses. And the another issue is high coverage surpassing the target. This is due to challenge in denominator. We continue. I think there is need to continue addressing the denominator challenge in the upcoming year. Next slide, please. So moving forward from 0 dose to DHAS, we have already, as I have said, we have already revised the routine immunization health facility data collection tool to capture the above 1 year data. So starting from January 2025, this tool will be used in DHAS, and the healthcare will be trained on these tools using integrated rollout of new HMIS tools. We are also planning to initiate effort to update digital system as per revised tool and data processes. Next slide, please. So, and this year we are planning to conduct the EPI review. So we are planning to leverage on the platform to conduct the assessment of big catch-up progress. Also, we are considering using a cordial headcount in resolving challenge of denominator, especially at the health facility level, not at the district level. Usually at the health facility, our data, our targets, they go down just to the at the district level. From the district to the health facility, they usually use consumption method, and we are encouraging using of other method to ensure they have the real target to resolve the issue of denominator. So Tanzania is now transitioned toward the restoration phase of recovery plan, and we will need support from partners to implement and document this learning. Thank you.
Yeah, thank you, Mdachi, for this really comprehensive presentation. And I see on the question and answer, there's a lot of questions, which is very good. So I think let's move to the questions and answers so that we can give more time to respond to this question. I see there are a total of 9 questions. And 6 have already been responded. So I think let's give priority to this question that are not yet answered. So let's start with the questions. Questions for Dr. Mdachi. Would the healthcare workers report big catch-up vaccination in both big catch-up tools and them too has? So anyone from the team can assist responding as well. Over to you, Mdachi.
Hello. We didn't get the question right. You were asking that if we are going to use both tool and big catch-up tool to capture the data. Oh.
Yeah, the question is from Esther Sikare. It says, would the health workers report big catch-up vaccination in both big catch-up tools and them too has?
Okay. Mujun is around. Let him. He will provide a clarification. Please, Mujun, go ahead.
Hello, thank you, Dr. Mdachi, and good afternoon, everyone. My name is Delphinus, and just to respond on the raised questions regarding the reporting data, BCU specific, if there will be also, okay, the plan currently for the last exercise that we did, data were within IVD's data collection systems. That will include the digital system that Dr. Mdachi has mentioned, the AFIA campaign. But starting from 2025, January next year, we have already integrated the BCU, especially data elements, into our routine data collection tools, and these tools actually will be integrated into DHIS2. So from starting from next year, we'll have only one source of routine immunization data that will be coming from IVD system, and this data will now be shared within the DHIS2. Thank you very much.
Thank you, Mujuni. And there are a couple of questions which were responded. So let me also look at these questions. There is a question which is responded by Jonah and Alex as well. So if Jonah, you want to say, or you want to add anything in addition to what you have just responded in the text, but also if you have anything to add.
Thanks, Nasser, and thank you for giving me the floor. I've been trying to help respond to answers as I'm the senior country manager. A quick introduction to all. Unless there are further questions, I want to give the floor to the country to really answer all these questions. I just really want to give an applause to Tanzania, but also a real big thank you for organizing this meeting, because I don't think that we have often enough these kind of opportunities to really celebrate success. So thank you very much for giving this opportunity for Tanzania to showcase all the hard work that they've done and the results that they've been achieved. Over.
Yeah, thank you, Jonah. So back to the questions which was not answered. There is a question from Senga which says, what are the specific challenges in the district, which I think is in Mbeya region that has yet to achieve high coverage rates? It has consistently been red over the past 4 years. So the country team, if you have any response to that, over to you.
Okay, thank you, Mohammed Nasser, for the just to respond on Senga's question regarding the poor performing council. In actually that one is in Songwe region, which was formerly part of Mbeya region, and that is it goes by the name Ileje. And this council has been persistently poor performing, as you can see in the presented map. But this year, early this year, actually some interventions was done. And one of the issues that we came to realize was the council at that time had the least number of outreach services that were conducted. So they had a lot of cancellation of outreach services. And looking at the geographical location for the council, it was even difficult for the teams to reach some of the areas, especially during the rain season. But that one was not the only reason. Rather, even the some of the optimization activities were not well captured in their comprehensive council plans. So starting from this year, the ministry did some initiative first to find a partner, an implementing partner, who is now based in Ileje, supporting the councils in all routine relation activities, including vaccine distribution, but also implementation of outreach services, and also supporting the defaulter tracing, but also reaching the 0 doses children that are not reached for immunization. So we hope starting from this year, 2024, we are expecting to see some shifting if other things remain constant. But as of now, looking at our cumulative data from January, the council is now doing better comparing to last year, same period. Thank you, Mr. Chairman. Back to you.
Thank you, Mujuni. I see all of the questions remained have been answered in the text, but it will be good if anyone from the panelists want to come in and respond to those questions. I see their response from Alex, from Bulula and others. So feel free if you want to come in and respond to these questions, since we still have some time. But for the participants, if you have read the response and you still have additional questions, you are also free to come in. Please just raise your hand and we will give the floor to you to answer any additional questions. Yeah, I see there is a hand. Unfortunately, I cannot see from whom, but yeah, Kekura, please go ahead. Just unmute yourself and you can speak. I see he lowered his hand, I don't know. Okay, so going back to the question, I see there is additional question coming in. There is a question from Christina, which says, is there a plan to make sure that this effort will become part of the routine immunization system to routinely catch up zero dose and under immunized children during routine immunization activities, moving from big catch-up to catch-up? Over to you, team, for the response.
Nilijibu au nalijibu? Hey, Nasoro, can I come in with this?
Yeah, sure, go ahead.
Yes, thank you very much, colleagues. Good afternoon, good morning. This is Alex from UNICEF, and thank you, Dr. Mdachi, for the wonderful sharing of the experience of Tanzania. We are part of the teams. Just to mention that we have been able to reach most of the zero-dose children from the cohort of the COVID-19. And what we realize is that we are now into the restoration phase, and we want into sustaining the gains that we had in the previous year in terms of working on the immunization systems to routinely being able to capture the zero dose in terms of the capacities of the healthcare workers as part of their routine services. As much as they are looking into the routine children's, they are now in terms of looking for zero dose children as part of their daily work, because we all know that in every year, there will be some sort of a zero dose children that will be coming in, even when you go into the 2025, 2026. So we are putting this as part of the routine services. So when we are doing the capacity building initiatives in the countries, we are now planning several trainings, for example, when we have introduced new vaccines, when we did the campaigns, and the best example is the previous campaign of the MR that we did. When we did the capacity building for the MR campaign, we also built the capacity for reaching the zero dose in the routine basis as well. So the same will also apply in the future capacity building initiatives. But most importantly, as Mjuni has mentioned, is that we had a separate data tools for the big catch-ups. And the routine data tools were not able to capture the zero dose in the routine system. So these data tools are now being updated, the hard copies, but most importantly, Tanzania, we have the electronic immunization system, the Tanzania Immunization Registry, and the Vaccine Information Management System. These are also being updated to include the zero-dose children as well. And this has been the good thing about Tanzania is that we had an immunization policy that was developed way before the COVID-19. And we realized that this policy has been clearly stipulated the need to capture the zero-dose children in the routine services. So it will be now more of operationalizing the routine, the immunization policy that is in place for Tanzania. So in the near future, coming from next year, we will be able to capture them in the routine basis. And what is the good thing about is the JRF, the joint report format that we are reporting every year. It has a clear specific sections in terms of looking for those catch-ups efforts. So the reporting will also be part of the routine reporting of the JRF in annual basis for the zero dose. So this is the next plan that we are thinking for Tanzania moving ahead of this zero dose big catch-up. Thank you. Back to you, Nasoro.
Yeah, thank you, Alex. I see there is a hand from Palenfo, but before that, let's give a floor to Ibrahim for any comment? Ibrahim, over to
Yeah,
you.
thank you, Nasser. Thank you, Tanzania team. I think this is very interesting to get some of these experiences being shared. Hopefully, I think I see a lot of opportunity to document some of what you've done through case studies. Your mobile app, for instance, it will be interesting to learn how that was integrated into the DHIS2 module and all that. But just responding to the issue around mainstreaming or ensuring continued catch-up, I think that is the ultimate goal of the big catch-up. Yes, we're trying to catch up on children that missed during the pandemic, but that is an entry point to ensure we align the systems. And that is why if you look at the checklist or readiness tool that we have, some of the questions we're asking are, do countries have policies for for catch-up? Good to hear Tanzania has that already, up to 5 years, I think, if I saw from the chart correctly. So that is good. And this is an opportunity to actually strengthen that, systematize that, look at the electronic registry or immunization reporting systems to ensure the data tools, the tally sheets, the registers, the home-based records are actually updated as an opportunity going forward. But very interestingly, also this will have implication in terms of your vaccine forecasting, because depending on what policy or how you interpret it at the country level, it will be very important to include this in your vaccine forecasting to ensure that vaccines are forecasted for the current infant age cohort, as well as the estimated catch-up, because there are some complications around there. People think maybe vaccines that are forecasted for infants should not naturally cover for catch-up, but we know we have wastages and expiries and all that. So that is some very interesting aspect to tweak a bit. I saw one question on zero dose, the definition, and I think maybe that is what Palinfo wants to talk about, the definition of zero dose. So in terms of the big catch-up assumption, and when you look at the reporting form, we're actually looking at 12 to 59 months, basically under 5 as that. But hopefully the data that Tanzania is going to report is going to disaggregate infant zero dose, which are part of the routine and should be part of your infant cohort, versus those that are 12 and above, 12 months and above. So yeah, let me just stop there. Thank you so much. Over, Nasser.
Yeah, thank you, Ibrahim. And I think let's move to Palenfo. He has his hands raised for a while, and then we'll go to Mdachi. And then there is a question in the chat for French, if someone can help to translate. Over to you, Palenfo. Can someone, Geraldine, can you help? He cannot unmute himself.
Yes, of course. Shall I give the microphone to Kekura?
Hello. Yeah.
Now he's unmuted. Yeah, over to you, Palenfo.
Oh, sorry.
Yeah. Okay. Thank you very much, Nasser, and thank you for the presentation. And thank to Ibrahim. It was I was willing to talk on this definition of the zero dose, because I had the question and the answer was that you said that a child from 1 to 11 months who were reached during PCU were considered as, were recorded as zero dose children. So I just want some clarification. Is the zero dose definition, is it regardless of the age for the child? Because sometimes I think that some of these children may just be late for their vaccination, but do you consider all of them as zero dose? yeah, just a clarification on this. Thank you.
Thank you, Palemfo. I think you bring a very critical questions, and there's a confusion around that in many countries. So I think the standard definition for Gavi is clearly a child who missed Penta-1 or DTP-1 above 1 year of life. So, but countries can have their own definition. So we'll hear from the country, but Mdachi, do you want to respond to that, or you have?
Yeah, Nasoro, you have clearly stated it. Is a child who missing a DPT-1 above 1 year. But when we are going for the vaccination, we are vaccinating all the children that have missed the vaccination. The good thing, we have a data tool that we can segregate the children who were below 1 year, so we can have big catch-up data. We can report the number of children who were catch-up, who are the target for the big catch-up.
Thank you, Mdachi. Kakuru,
Naso, please,
go
can you please allow my
yeah,
boss
sure. If there's anyone from the team wants to add, please go ahead.
to say 1 or 2 words?
Please go ahead.
Thank you very much, Nasoro and Mdachi, for presenting this big catch-up from Tanzania. I just want to highlight that for sustainability purpose, the country has planned, and we've started doing the integration of BCU in the routine immunization, because this is so costly, and for sustainability purpose, actually we need to integrate both, so that we use the little resource we have to make sure that we reach all 0-dose children. And if you remember that we have revised the denominators, so hopefully after the analysis which we are doing currently, the number of 0 doses will increase. And definitely the resource should be also increased. So if we want to integrate, I think we'll end up again back with accumulated number of 0-dose children. But we also have the plans to strengthen outreach services countrywide by collaborating with the PRH, and also we are hoping the next financial year they will make sure they budget the outreach services. They enter in the budget the outreach services so that we won't cancel the outreaches because of lack of resources. But also we have started campaign of communication and advocacy. We are doing the campaign countrywide currently, especially in areas with low performance and with regions which have high number of 0-dose children. This is to make sure that we don't reach anyone, we reach every child up to the level of the community. But bear in our minds, the government has started using the platform of CHW officially. So we are going also to use the CHW to make sure that we reach every child at every last mile by using the little resource which we have and do the integration. And we are hoping we will sustain this, and we want to be back as we will be as pre-pandemic period where the vaccination coverage will be reaching above 95 as the plans and the recovery plan of the country. Thank you.
Thank you, Georgina, for the addition. I see there is a hand from Kokura. If Geraldine, if you can give the mic to Kokura for, yeah, go ahead, Kokura. Kokura,
Oui, bonsoir.
yeah, go
Oui,
ahead.
bonsoir.
Yes,
Bonsoir.
we can hear you.
Ah, d'accord.
Thank you very much for this presentation. It was extremely interesting presentation. And I have a question. How can you correct the administrative data compared to the data that comes from the ground, what is reported from the field and in the administration? So is there any like correction that you apply? And also, based on your experience, is there like a big gap between both? And I have a second question. For zero-dose children, some of them can be in really remote areas. So what happens? Do you also have like specific campaigns? Because we have some mobile services, and we were kind of thinking on how to implement those. And I also posted my questions in the chat just in case, as my connection is not very good, but hopefully you understood my questions. Thank you.
Yeah, thank you. Did you hear the questions in translated mode or?
Nasoro, can you summarize them, please?
Yes, there's the question.
Geraldine or Elias, can you help to summarize the question?
Nasoro, if I may come in.
Yeah, sure, go ahead.
I think if I get it well, the first question was asked about whether the numbers of the reports that are coming down from the facilities, we do some sort of a checking with those that we have in terms of checking the qualities of the data that are coming from the facility levels, whether this is the routine of the zero dose, if I get it correctly.
Yes, you are right.
Yes, you're right. Sorry, Nassau, I was trying to find my
Before responding to this.
Yes, the mic. Okay, great.
That's correct.
Yes,
Yes. I think in the way that we are doing the data checks, we have several ways of ensuring the quality of the data. And one of them, we do the data cleanliness at national level. First of all, we have a national level data technical working group, where the ministry and the partners, they are sitting in terms of periodically reviewing the data that are coming from the levels, and whether we have a challenge in terms of the quality of the data, we are getting them back to them to clarify some of the data through these technical working groups. And but most importantly, we have a data validation system that is also in place, where we validate the data that are coming from the facilities. But most importantly, we are doing some sort of data audits. These data audits are also part of the routine services to look any data that is reported at the facility. We make sure that this data is really the real data, is clean and is of a good quality. So that is one. And in annual basis, also we are doing, before even the whole process of submitting the overall national data through the JRF, we have an intense workshop in doing the thorough data validation and data review exercise, data quality checks before final submission to the regional level and the HQ. So these are some of the ongoing routine data check screenings that are happening in the country to ensure that the data are of good quality. Thank you. Maybe my colleagues will come up with a second question.
Yeah, thank you. And the second question was whether you are doing a campaign or not to reach some of the specific target population he mentioned. Over to you.
Hello. We have different approach to reach out to the children who are marginalized. We have a periodic intensification of routine immunization activity. We have outreach services. We have strengthened reaching every child strategy approach in the health facility, so that routinely the facility can still catch up to the children. So we have a variety of method. We didn't have a campaign per se, but we have it was sort of that. It was periodic intensification. We mobilized the community, and later in some of the area they move from house to house to ensure we are catching up to the children who are not vaccinated.
Yeah, thank you, Dachen. Thank you, colleagues.
We did have the campaign. We did integrate with the measles rubella, which we have we have more resources, and we are moving from, we have outreaches, facility, fixed facility. So we did take that opportunity also to integrate with the big ketchup sauce. So it was a kind of platform to increase access to to marginalized children. Thank you.
Yeah, thank you, Mdachen. Thank you, Tanzania team, for preparing this. I don't see any additional hand. So let me give this opportunity to panelists to see if there is anyone who wants to add or say anything. I see Jonah. Please go ahead, Jonah.
Thanks, Nasser. And again, thank you very much for inviting us and being part of this panel. As I mentioned, I'm very grateful for this opportunity to celebrate the success of Tanzania, which they greatly deserve. I think it's important for all participants also to understand some of the context in which we have developed the catch-up strategy. Tanzania developed its catch-up strategy in Q4 of 2022, and this is before the launch of the official Big Catch-up initiative. So Tanzania was proactive. They looked at their coverage data. They utilized available data sources from, for example, polio, but also the measles outbreak to identify the most vulnerable areas, and proactively developed a strategy that is not super complicated. It's not something that countries are not already doing. For example, quarterly PD supported by targeted demand generation efforts. This is a well-known strategy in the majority of countries. And then we started implementing the catch-up efforts as of January from 2023. This is why Tanzania is able to be so far ahead of the curve. We were lucky to have balances in country. So we had Gavi, a grant of 5.8 million of PBF. That's a former grant, a form of HSS cash grant that we were able to reallocate to support this. And as such, we didn't need separate approvals, but we could move ahead. So I really want to encourage countries to learn from Tanzania, to be proactive, not get bogged down in trying to develop first the perfect strategy, because as we all know, there is no such things as perfection, but really go forward and move and act and use the available strategies that you already have to build on reaching those children. So I think if any lesson comes from Tanzania, it's to get going. Don't wait for perfection, but really start reaching those children as soon as you can. Thank you very much, and over.
Thank you, Jonah. This is really helpful, and you said it very well. And I think the participants have heard you clearly. I'm not sure if WHO country office is attending, so that we can hear at least a few words from them. If not, then anyone else from... Yeah, Sarah, go ahead.
Yeah, Mwenge, I'll speak on behalf of Mwenge. He was online, but we are in a meeting also here in Tanzania and out of the room. But just he also to do a comprehensive program review in November, during which we've also integrated looking into the big catch-up data systems and the big catch-up strategy, and maybe inform a little bit better in terms of planning of regular routine catch-up going forward, which will be part of the NIS development for Tanzania. So we're looking forward to seeing what the EPA review will look like and what the findings and the recommendations. There's also the joint appraisal that's coming up in December. So a lot of activities are happening here in Tanzania. And I just wanted to commend the team for really the fantastic collaboration on the ground among partners. There's partners who are not on this call because they're in other meetings like Japaido. I know there's PATH. They would have wanted to be here. But just to really commend everybody for all the efforts that have happened in Tanzania and to say that we are still very much committed to supporting Tanzania as we see this progress. Thank you. But maybe over to Georgina.
Yeah, thank you, Georgina.
Oh, thank you very much, Sarah, for the compliments. And thank you, team, for good collaboration. This has been happening because of good collaboration from partners and from Gavi. We are getting support from in-country partners and Gavi. And we are still hoping that we will continue getting support, both financial and the technical support, so that we can sustain these gains which we have already achieved. But one thing which we forgot to mention, we also want to revitalize TIMRI, and we think this electronic immunization registry will help us to make sure that we don't get much of the 0 dose, because it's very easy to track those people who has missed the immunization after the end of the month. So by saying this, let me thank my team for this good job which they have been preparing on the ground. And thank you very much for WHO and the other partners, Nasoro and others, for helping this to happen. Thank you very much.
Thank you.
Gavi, thank you so much for the support, both financial and technical support. Over to you, Nasoro.
Thank you, Georgina. Let me see if Ibrahim, you have any final words you want to say?
Yeah, thank you. I think this is very interesting, and thank you to the Tanzania team for sharing their experiences. And yeah, all the good comments have been made by Jonah and Sarah and Georgina. I think these are well placed. We're looking forward to continue to work with the country office and the regional office as well to see what kind of support is needed to improve and also streamline catch-up going forward. Thank you so much, Nasir, for facilitating. Over. Thank you.
Yeah, thank you, Ibrahim. Elias, do you have anything to say since we have time?
Yes, thank you, Nassau. I think I wouldn't go on talking about the good work from the Tanzania team, but maybe just to share with participants that we have a couple of questions. I've shared the link on your appraisal for the webinars. We have just 5 questions for you to go through. So please just take some time. It can take you 2 minutes to go through these questions so that we have some feedback on how we are doing with the webinars. Thank you very much.
Yeah, thank you, Elias. And I just want to emphasize on that. This is really going to be very helpful from our end as a regional working group, getting your feedback so that going forward, when we organize this kind of event, we can take into considerations what you have suggested. So after saying that, I don't see any other questions that are pending. So let me take this opportunity to thank you again, Tanzania team, for the work well done and for your time as well to prepare this presentation and present it to us and share the learnings. We really congratulate you for the hard work and the effort you put behind this. We know this has not been easy. There is a lot of challenges, as you have mentioned, but you have said it well that political will helped a lot. And we believe that when there is a will, there is always a way. So you have found your way despite the many challenges you have faced. So on behalf of the regional working group members and colleagues who are working at the regional level to support monitoring big catch-up in the Eastern and Southern African country, we also appreciate your time. But we also believe that these sessions we are going out of these sessions with an actionable insight, and we learned a lot from you on how to continue supporting you and working with you closely to make sure that these big catch-up efforts have the fruitful deliverables as expected. But as other colleagues said, Ibrahim said it as well, the aim is not to just end with the implementation of big catch-up, but rather to make sure that catch-up is part and parcel of the routine immunization system, since we believe that even going forward, there will be some children who for some reasons will be missing, and we will need to catch up with them to make sure that we leave no one behind. So after saying that, I think we have few minutes left, but we can end our webinar here today, and I hope you have enjoyed and learned a lot from the team, and feel free to continue asking questions. We can coordinate through the regional working group for other countries if they need additional clarifications or additional information from the team. I hope Tanzania team will be generous enough to continue providing learnings to other countries as well. With that said, I think this is the end of our webinar today, and thank you everyone for your time. Have a good day.
All right.
Thank you, everyone. Have a nice day. Bye.
Thank you, everybody. Thank you, and thank you again.
Bye-bye.
Merci, merci.